Hi, STC family. My name is Hermainne Thomas, and I will be sharing a bit about my career. I am a qualified radiographer, diagnostic radiographer, and also a sonographer. I am duly qualified, and I'll just be sharing about these two careers. Let's start with my diagnostic radiography qualification. While to study ultrasound and sonography are the same, to study ultrasound or radiography, when I applied, the subjects that you would require to apply for these qualifications are maths or science, and biology was strongly advised. But I think with the new curriculum, I think you need to have both maths and science and also biology. They take small groups in, so it usually involves an interview as well, apart from your marks that they take in. And these qualifications are usually attainable at universities of technology, or previously known as technicons. They used to be with the universities like Stellenbosch University, but they were moved over to the universities of technology. So my diagnostic diploma is a 3-year qualification that I did, but it is now a national diploma, but it is now a straight 4-year BTech qualification. It basically entails taking x-rays, which is the most well-known part of it, in hospital settings. We also work in theatre with what we call fluoroscopy cases, CT scans, previously known as CAT scans, and also MRI scans. So within diagnostic radiography, there's many fields that you can go into. Mammography, or images of the breast, is also a very, very large field, and you can qualify as a mammographer. So any one of these branches you can actually specialize in once you've become a general or a diagnostic radiographer. The career opportunities for radiographers, I haven't heard of any of my colleagues that are struggling to find jobs. Actually, jobs find us. Radiography is a very sought after field across the world. So I know of many of my colleagues that are working overseas. You often find people offering you jobs on LinkedIn as well. So there's no shortage of work. I sincerely do not know of a radiographer that is struggling to find a job. So career opportunities are endless. Myself, I've been overseas as well with this career, and I find it very, very gratifying and very satisfying. So when you study radiography, diagnostic is just one branch of a very big tree, but diagnostic is one of them. Then there is therapy radiography, or radiotherapy, which is where the radiographers help with the administering of radiation treatment for cancer patients. Then there's also nuclear medicine, and then there's ultrasound or sonography. So after I obtained my 3-year qualification, I opted to specialize in ultrasound, which now is a standalone qualification, also a straight 4-year BTech degree. So I've got a national diploma, a 3-year qualification in diagnostic radiography, and then I've got a BTech degree on top of that in ultrasound. So ultrasound is basically the imaging of the body using ultrasound waves or ultrasound machine. The most well-known part of ultrasound is obviously the obstetric and gynecology part, where we look at babies, but we do so much more. You can do ultrasound of the eyes, you can image blood vessels from the crown of your head to the tip of your toes. Newborn babies, we can actually image their brains. The most common ultrasound people come for is abdominal ultrasound, where we ultrasound your abdomen and all the internal organs. And musculoskeletal is also quite big right now with sports injuries and all that. We can look at the integrity of the muscles and all that. So ultrasound is quite a wide field. There's so many things that we can look at, and the thing is, it doesn't have radiation in it. I mean, the machine, there's no emitting radiation, so it's completely safe. So people are opting more for ultrasound these days. So who would like to be a sonographer? Who would like to be a radiographer, you might ask? Well, you'd have to love working with people and helping people, have a heart for people. I think that's so important. And yes, you need to be a bit of academic, because there is a lot of anatomy, physiology, and science behind it. But there's also a bit of technology behind it. So if you had to marry a bit of IT with all our machines that are forever changing and expanding, and you marry that with like a love for people and the medical field and helping them, I think this might completely be your thing. Obviously, shifts and all that are involved. So a hard worker, somebody that's dedicated and a good team player, that would really be advantageous to you. So yeah, I studied 6 years in total. I started doing my BTech and then I switched my major to ultrasound. So altogether I studied 6 years, but 4 years for diagnostic radiography and 4 for the other. And yes, there are still places where I can use both the qualifications, but currently I am employed by a private practice and I'm just practicing ultrasound, and I have a 9 to 5 and only work from Mondays to Fridays, and really just work on the odd weekends. So the hours are good. We don't only stay in the department, we do also go to theatre, we also go to the ward, so we do see the rest of the hospital. But I really enjoy what I do, and I really love seeing my patients, and I really love working with them. So yeah, I hope there are some aspirant radiographers and sonographers out there. I hope this is a field that some of you might want to consider if some of the attributes that I mentioned appeals to you, or ones that you possess. So is there funding available for ultrasound and radiography fields? There most certainly is. Government bursaries were quite common while I was studying, but also there's many bursaries available at some of the private practices, and they also offer employment often after the bursaries. So once you've been accepted to study ultrasound, you can inquire from the university. In one of my years, all of my classmates actually had external funding. I also had funding. I was fortunate enough to get a government bursary. So yeah, funding there most certainly is, and that goes a long way. And yeah, may God bless you. And yeah, and I just want to say, may this STC platform be blessed beyond measure. Jill is doing such a great job. She's got a heart of gold. And I just hope that this career expo just opens everybody's mind to many things, but more so that people might be attracted to what exactly she's doing, because she's doing such a great thing. Take care and God bless. Bye.